Okay, so I don't think there are any easy answers, but let me give you the grand tour as I understand it. We have three categories of institutions and people getting paid right now. We've got the providers. These are the people who actually provide medical services, doctors, hospitals, pharmacies. I'm considering that what we're paying them is getting divided up into three categories. The medical services, the actual, giving us an injection, setting a broken bone, taking our temperature. There's some administrative costs, which is where they submit bills and do lots of paperwork. And then there's the profit that they make. So that's our providers and their costs. Then there's the insurance companies. They also have administrative costs, and they also make a profit. They do not actually provide any medical services. That's something to remember. These companies just collect our money and then pay it back out again. Then the last category is the government, state, or federal, and that's pretty much just administrative costs. The government, of course, runs Medicare and Medicaid, and also it subsidizes a lot of hospitals and gives a lot of money to the overall medical system. So these are the three categories: the providers, people actually giving us medical care; the insurance companies, people collecting and distributing money; and the government. We're all familiar with the government. I've also got four plans. We've got what we've got now, which is to say kind of a big complicated combination of insurance companies and the government and people working and getting insured through their companies and all that, and people not working and having to buy it on their own or not buying it. The situation we have now, the problem is it will bankrupt the country. Okay? We know that. There's another option, which is what we have now plus a public option. This one has the advantage that everyone would be covered, but unfortunately it will also bankrupt the country. Then there's single payer, which was my former favorite option. It's like Canada and Europe, where the people seem to be pretty happy and pretty healthy. They have better statistics than we do in many ways. It's efficient, but cost control is difficult because, of course, it's hard for the government to say no to somebody, and so costs can get out of hand. Insurance companies don't have any trouble saying no to people, and that's another problem. Then here's the last category, or the last plan, which is the David Goldhill plan, which is my current favorite. It's a combination of catastrophic insurance, so you don't go bankrupt because you get sick, and health savings plans or health savings accounts, where you save your own money and you spend it on your own health. This has the advantage that individual consumers will make their own decisions, they'll shop for value, and it won't bankrupt the country. Yay! Okay, so back to the overall picture. In these four plans, the money gets broken out in different ways. And I don't have the exact numbers on all these, so someone with more knowledge and more time can do that. However, I can show you the really big gross difference is that with the last two options, which do not include insurance companies, we would save a lot of money. I've heard that it's about $40 billion that we would save if we took the insurance companies, which are just middlemen, out of the picture. Now, of course, the insurance companies don't want to be taken out of the middle, and so they are fighting like crazy and pretty much buying our government off to keep them in their position. So this is really the big choice before us, whether or not to keep the insurance companies. And I would have to say that since this is a matter of life and death, we ought to get rid of them. And if your congressperson votes for any plan that includes keeping the insurance companies, we should try to vote them out. It's just a bad idea. The two plans that don't include the insurance companies are the single payer and the catastrophic care plus health savings accounts, a la the David Goldhill plan. Let me give you a simpler diagram than this to review.